Symptoms of COVID-19 include shortness of breath and other respiratory issues. Pulmonary professionals at SSM Health talk about the difficulties patients, families, and staff are going through as COVID hospitalizations continue to increase.
We are currently in a situation in the area that we have very limited beds in the hospital. Our resources are very strained. If any of the staff, including the doctors, nurses, and other staff get sick, we won't have people to take care of those people who are coming in. So we can end up in a situation where people get very sick, there is nobody to take care of them, or there are no hospital beds for them to be admitted to. And that would be a recipe for disaster.
On a normal day, we would have 4 respiratory therapists spread out throughout the hospital. And today we have 6, and we could probably use 8.
I guess people don't realize it till they get it personally, or one of their loved ones or somebody closer to them gets it, and then they realize that it is real. People can get sick, and eventually it can be very consequential, and people lose life and their loved ones.
We have a patient that I took care of today who I took care of in August, and he was very serious, and now he's back. And he said, I just can't swing it. He said, I'm on oxygen, I still can't breathe, and this is months and months.
When you are talking, eating, even passing by someone in the grocery store, the respiratory droplets that we project can be emitted and transmitted when we are unaware.
It's not just the older people that you would think, the people that have breathing issues or diabetes, it's all ages. We're seeing 50s and people that were construction workers and just working, and all of a sudden 2 days later they feel terrible.
With the holiday coming up, it is very difficult not to socialize in large gatherings. Modifying what we do, smaller gatherings, in outdoors if possible, wearing masks, hand washing is crucial.
When you're eating dinner, that is a huge, huge time whenever people are having conversation and eating at the same time. You don't realize that there's saliva being transmitted. It's just keep your distance, maybe have several different tables.
It does affect you, especially in people who are working constantly in the hospital. It can affect your family life. You don't have enough time for your kids.
You try to be there for the patients because their family members can't be there. You try to help them communicate with their family through texting, through iPads. The family members are confused. They don't know what exactly is going on, so I try to intervene and explain what's been going on with the patient.
The difficult part for the family is they cannot come and visit their loved ones. So we have seen here in the hospital when some people died and they did not have their loved one close to them. So it was very hard for the patient. It is very hard for the families to go through that when somebody is dying and you cannot have your family right beside you at that time.
I'm used to seeing death and dying, but in this era that we're in right now, it's harder because you might be the sole person in the room with someone dying and their family members can't be there, so you're the one that has to hold their hand as they pass on.